this is Attorney Walter Hnot. I'm really excited about this particular video because I've got a vet specialist here, not just a surgeon, which is kind of the upper end of that echelon. And I want to go through something really quick with you. This particular individual is going to talk to us about something that is affecting a lot of disabled dogs, disabled cats. And as somebody who himself works with the disabled and has two little adorable piggies named Sweetie and Shadow, I can tell you this, I've been very, very worried about this particular item because Sweetie, as you know, last year, 2024, had cancer. She also had 2 TPLOs. With us today is the surgeon who did 3 major surgeries on Sweetie, and I'm extra happy to have her on the show. I want her to go ahead and introduce herself. Madame, walk us through what you do.
Thank you so much, Walter. I really appreciate the opportunity to be here. Thanks for having me, and it's an honor. My name is Andrea Clark. I am a veterinarian and a veterinary surgeon.
Excellent. So can you walk me through with these situations? We're talking about cancer, not a little thing. And this cancer, does it have the ability to spread, or is it one of those things where it happens in one spot and that's it?
So this cancer is a scary cancer. It not only is it locally invasive, it can spread to internal organs all throughout the body. So it's a big time worry for pets and pet owners. And as a veterinary surgeon, a big time worry for me as well.
So what happens with this? I mean, can you tell me what is the name of it? How does it spread out? How does that work?
Yeah, so this particular type of tumor is called mast cell tumor. It affects dogs and cats. We see it in different forms. It can be what's called dermal or subcutaneous. Doesn't really matter. Let me just tell you, the fact of the matter is that it's serious, and it can spread internally to the lungs, the liver, the spleen. So you need to take it seriously. And it's something that's not a force to be reckoned with.
So, I mean, help me out with this. Like, are there stages to this cancer? And I mean, when it spreads, is it like, something where you can see like a giant bulge, or is it like the tiny little tentacles? Like, how does that work?
Yeah, so that's a great question. So there are definitely grades for mast cell tumors. There's grades 1 through 3. Grade 1 is, the least severe, so to speak. But all of these tumors, all of these mast cell tumors are severe, and they are not something you want to ignore or put off. Grade 3 is the most aggressive and will spread to internal organs the quickest.
Okay, so when this thing becomes a real problem, how does this affect the animal? How does it spread to different organs? I mean, is it like with humans where it goes to lymph nodes and other organs, or is it one of those things where it has a path that we always know it's going to take?
So, yes, it's somewhat like humans. It can spread through the lymph nodes. In fact, one of the things that, as a veterinary surgeon, when I see a patient that has a mast cell tumor somewhere on their body, on the skin, whatnot, we do want to check those, what we call local lymph nodes, that are the closest draining point, because the lymph nodes are essentially the garbage collectors of the body. And so any, cancer cells that may be spreading are going to go to the lymph nodes first. So we do try to check those first. But sometimes with mast cell tumors in particular, they can be super tricky because they can evade those lymph nodes and actually spread to internal organs like the lungs, the liver, the spleen, before we even see them in the lymph nodes. So it's really scary.
So, okay, let me understand this real quick. Is, obviously with COVID, we weren't super awesome at testing for it every single time. And then, of course, treatment was not also amazing. So, I mean, when it comes to these tumors, can you walk me through, do we have a de facto perfect test, or at least a very, very, very good test? Or is this one of those things where, we sometimes get it right, we sometimes get it wrong? Walk me through, how worried should I be about the accuracy of the test?
So if you're talking about the test, so say, your Sweetie, for example, has a lump or a bump near the shoulder. You feel it, you're like, oh gosh. It can be the size of a pimple. It can be the size of a bug bite. You should go into your vet and have it checked. Mast cell tumors in particular do tend to what we call exfoliate well, meaning we can just take a simple little needle, just like a vaccine. It's just like it feels like an insect bite. So it's not something that's painful. It's not invasive, but they tend to exfoliate well, meaning we can stick that needle in that little lump or bump, get cells out, put the cells on a slide, and see that it's a mast cell tumor. Luckily, that's the one good thing about this type of tumor is that it's pretty easy to diagnose.
Okay, now I've heard that with these particular tumors, with this particular situation, that these have the capacity to literally over a 24-hour period change in size, grow much more. I mean, how dangerous are these things?
Yeah, so you are absolutely right. These tumors are very unique. There's not a lot of tumors in veterinary medicine that can literally change size, not only overnight, but within a matter of minutes. And that's because these tumors, mast cells are a normal cell in the body, human bodies, animal bodies, we all have them. And mast cells have what's called granules that contain histamine. Histamine, you think of like allergic type reactions, things like that. When mast cell tumors get angry for whatever reason, it can be as simple as, you petting your fur baby. That can aggravate a mast cell tumor and cause it to get bigger because it releases those granules and releases that histamine. And so they literally can just explode like no other type of tumor in veterinary medicine within minutes.
So these things explode in growth and they can grow and grow and grow. Can you walk me through, like, at what point would you as a surgeon know that there's hope? And at what point would you know that there's no hope to put the dog through this surgery or the cat through this surgery? It wouldn't make sense. Yeah,
that's a great question and something that's super, super important. So before going to surgery, we really need to do our four-legged friends due justice and do some tests. We need to do some blood work, make sure that, first of all, we're safe for anesthesia. The blood work's not going to show whether the mast cell tumor has spread or not. But if we're talking about surgery, we need to make sure that we think that your, four-legged family member can withstand the surgery. Anesthesia, it's a real thing. It's a real, risk with people and with animals. So always blood work. Other things we do, sample local lymph nodes. Like I said, if it's, shoulder, like there's lymph nodes in that area that we can take a little needle. Same thing as with the little mosquito bite sized tumor. See if there's those types of mast cells in those lymph nodes. And if there are, then we know, okay, there's signs of spread. We need to take that lymph node too. Now, your question was great. When do we know we need to stop and consider possibly not doing surgery? Very hard question, always very emotional, never gets easier even as a surgeon. But so there's other tests like chest x-rays to look at the heart and lungs. If there's signs of spread of that tumor to the lungs, it's not worth putting your beloved pet, your beloved four-legged family member through that surgery. Because every surgery, there's pain, there's recovery time, there's things like that. And so that's when you start looking at other options and you need to consider, what can I do for the quality of my pet's life? Because they deserve that. Same thing, we can do ultrasounds, not necessarily x-rays of the belly, the abdomen, ultrasounds of the liver and spleen, same thing. Mast cells go to lymph nodes, lungs, liver, spleen. Those are the organs you need to check to make sure before you put your family member through this surgery, check those organs to make sure that you're doing them the right thing.
So help me out with understanding this, because one of the things, I'm kind of curious about is, okay, let's say that somebody's rubbing down their dog and they find a unique bump. And let's say, it doesn't go away after a couple of days, not a mosquito bite or something like that. But let's say they find a bump and they're like, okay, I better get this thing checked out. This is new. This wasn't here. Maybe it's like a week old. Maybe it's 2 weeks old, whatever. What is the process like for, checking in? Like, how do they get a hold of you? How do they, figure out what the steps are? I mean, obviously they wouldn't go to the surgeon first, right?
Correct. So yeah. You don't need to come to me first. I'd be happy to help you if you did want to come to me first, but that's not necessary. Go to your regular vet, your general practitioner, the one that knows you and your pet the best. They are perfectly capable of doing that initial test where they stick the needle in there and do what's called cytology to diagnose whether or not this little lump or bump is something to be worried about.
Okay, so help me out with understanding this. Where do you work? What's the place like? Let's say that, boop, it is, test comes back, mast cell tumor. It's, not good news. They've got to go to surgery, referred to you. Where do you work? What's the process like? How does that come down? And what do you instruct the parent, the dog mom, the dog dad, the cat mom, the cat dad?
Yeah.
What do you tell them to do? Yeah.
Yeah, so I work in Clearwater, Florida, at a clinic called Fetch. It's, super easy. Just put in Fetch Clearwater. You can find our number. You can find my email at the clinic. You can email me directly. You can call and ask to leave a message with me directly. But you don't have to have a special referral or anything. Some clinics, like specialty clinics, do require your veterinarian to, call the surgeon directly and do that professional to professional referral. That's not the case at my clinic. So you can even just call the main number, say, hey, I want to schedule an appointment with Dr. Clark, and the receptionist will be more than happy to do that. And more than happy to help you and your loved one.
So let me ask you this, because, price, obviously, with our loved ones, things are a lot more expensive post-COVID, so are there ways that people can kind of pay things off over time? Is there a way that, they can kind of pay later? What options exist out there that you guys use at Fetch?
So that is tough. It's tough everywhere. Veterinary medicine, the price of it is getting more and more expensive by the day. I'm not going to try to beat around the bush. I'm not going to try to, paint a rosy picture. It's expensive. And, people a lot of times are like, oh, well, I pay less for my surgeon, my doctor, this and that. But you got to take into account the fact that you have insurance. As far as options that are offered, so there's always things like care credits, scratch pay. There are third-party companies that you can resource, banks and such, that you can pay monthly. And it makes it more affordable for you, so you can make monthly payments instead of paying the full thing in advance. So there are definitely options, even if you can't afford the surgery right off the bat.
I understand. Look, this is probably, I'm assuming it's not super expensive. It's not super cheap, somewhere in the middle. But walk me through this. What happens if you don't have the surgery? Like walk me through an example of a dog. A dog gets it. It grows. What's a reasonable growth pattern? And then does it have the capacity to shut the organs down of the dog?
So that's a tough question. Walter, I really wish I had a crystal ball. I tell my clients this all the time. It would make my job so much easier if I had a crystal ball. Unfortunately, I don't. But what I can tell you is with mast cell tumors, they can spread super quick. They can be locally invasive, meaning just, right in the area that they first pop up. They can, affect that local area super quickly and super aggressively. And then they can spread to internal organs. Again, it does depend on the grade. But you only know the grade based on biopsy. You can't know the grade based on that little needle sample that your regular vet does, unfortunately. Again, crystal ball would be great. But so if you can't go to surgery right away, my recommendation as far as mast cell tumors go would be talk to your vet, your primary vet about antihistamines, something such as Benadryl, famotidine. Those things help keep histamine in control, which helps keep the tumor under control. Maybe start saving some resources, and eventually, get to a point where you can afford the surgery. That's my best advice.
So let me ask you this. Okay, you're a surgeon. You've done a ton of surgeries, a ton of surgeries. You've worked with one hospital, which is like, the name brand place that a lot of people have used and things like that. Now you're with a new group, and I want to ask specifically about this. Now, you are, just so I understand, I know you've done Sweetie and many other dogs, but I want to ask, and feel free. I know it's a very direct personal question on this. What is the largest mast cell tumor that you have ever removed from a dog or a cat or some other animal in the history of you doing these surgeries?
Yeah, it's a great question and makes me need to like rack my brain a little bit because I've done so many of them and so many of them are so big and so ugly. So the worst one that comes to mind actually was on like the arm of a Weimaraner towards the wrist. So any limb, any leg, essentially, leg, arm, there's not a lot of excess skin. You know, you pull the, like, mast cell tumors, you need to get what's called wide margins, meaning they have tentacles of cancer cells, essentially like an octopus has tentacles. These things are microscopic. We can't see them. We have to assume that they're there. And so we have to take extra tissue, skin, underlying tissue that looks, feels normal, just knowing that there is cancer there. So the worst mast cell tumor I've removed was on like the right wrist of a Weimaraner. Popped up super quick, started size of a marble within a week, was a golf ball, and then within 2 weeks was essentially an orange.
Holy cow.
It outgrew the blood supply, actually ruptured, was just a chronic open wound, just constantly bleeding, chronically infected. There's no way to actually remove that tumor and get clean margins without amputating that limb, except in the case of doing like special skin graft techniques.
Okay, so that's a really, I haven't heard that word a lot. Special skin graft techniques. We have this in the human land, but honestly, with a lot of the disabled claims I get, I don't see that a lot. They're usually just stretching the skin over, putting it together with staples, sewing, it together, etc. What are we talking about with special skin grafts? Like, how does that work on a dog or a cat? Yeah,
so there are techniques very similar to people, actually. Both, grafts from the same person, the same animal from different parts of the body that, serve as donor sites. There's, what we call, like porcine, bovine. So pig skin, cow skin, these things, they're great grafts, but there are downsides. My favorite technique is actually like a tilapia type skin graft.
What does that mean, tilapia?
So it's fish. It's a fish skin graft, and the big plus to it is that when we compare it to cow skin grafts or pig skin grafts, those have a real high chance of transmission of viral diseases.
Oh wow!
Yeah, from because they're mammals,
yeah.
So they can transmit diseases from that graft, from that cow or that pig to the human or to the dog or to the cat.
Sure.
That's scary. That's scary. With fish skin, we've found that risk of viral transmission is not there. And so, and aside from that, the structure of the skin of a fish is very similar to mammalian skin. So on the microscopic level, the different layers of the different cells that make up that skin are very similar, which makes it easier for the human, dog, cat body to then say, hey, I recognize this, and I'm going to grow my own skin cells on top of this graft. But again, there's also the fact that there's not that risk of that viral transmission of diseases, which can be deadly.
So you said, we had a marble and then went to basically a golf ball and then went to an orange size. When you cut that thing out, the thing's still alive. It's still there. It's still present. What does it look like?
Kind of like an alien.
Yeah.
To be honest, kind of like an alien. And every single one of them looks different. it's really humbling. It's remarkable. Every single time it's different, but every single time it's ugly.
Jeez Louise, because is there any way that you think you might be able to get us a picture? Because I am curious about the medical. I mean, obviously, maybe you can, maybe you can't. But the bottom line is like just a tumor of that size on the leg of an animal, and this fish graft you talk about. Is it like a particular type of fish, or is it like is there a magical unicorn fish? How does that work?
So, I mean, there is a particular, specific graft that I use the most, and that is the Icelandic codfish. So it is actually thought to be superior to tilapia because of that microscopic, like I talked about. So skin has multiple layers of different cells that makes up that skin layer. And codfish skin has been proven microscopically to be more similar to mammalian skin than tilapia. So my go-to is Icelandic codfish.
So like, do you glue it on? Like, how does that work?
No. So it's a whole process. I mean, it's a surgery. So, it's a big deal, but at the same time, it's necessary. I'm never doing it if it's not necessary, but essentially you want to have a healthy wound bed, or, just be removing a tumor primarily, at the time of tumor removal. You then, while it's still a fresh surgical wound, apply the graft. And when you do that, you want the blood supply of that site to be robust. You want it to be healthy, not infected, robust. And then you suture it to the surrounding skin. You make it a perfect perimeter of the wound, suture it to that perimeter, tack it down in special areas of that wound bed so that it sticks, and then the body does the rest.
So let me get this straight. So you have a magical fish, a unicorn fish, if you will, that basically goes on the skin. But how does the body of the dog, does it grow the proper skin there, or is it like a hybrid skin of like half fish, half dog?
So it's super cool. It's super exciting to me. So what that codfish skin graft does is it essentially alerts the body that, hey, you need to fix this. You need to bring in cells that used to be here in this particular area. So it recruits those specific cells. And so I've applied grafts, say to equivalent to a person's hand. When you're looking at a dog or a cat, you have skin, you have paw pad, right? Very different tissues. Paw pad's very rough, has a lot of keratin. Skin, soft, more supple, more flexible. So I've applied these grafts in one solid sheet to areas that included just regular supple skin and paw pad, and the body regenerates on its own paw pad versus regular skin. So these grafts literally are kind of like a guide for the body. They tell the body, hey, they recruit the specific cells that are supposed to normally be in that specific area, and they can be right, abutting each other, adjacent to each other, but they recruit those cells in a way where the body says, hey, I need to grow skin here, but paw pad here.
That's amazing. That is a little bit, honestly, at first I was like, I don't believe you, because to me that's like, so you're saying that it can have the body recognize what type of cells, what type of skin, what type of different skin to grow in different areas. So, I mean, just to clarify, would it grow along the paw line of where the paw pad originally was, or do you get like a weird area?
Absolutely right along the line. And Walter, it's amazing. I didn't believe it when I first started using it. I myself was very skeptical and was like, there's no way this is going to work. But it has proven me wrong, and it is reliable, and I've had such great results. And there are so many four-legged family members that have just absolutely benefited from this and gone from a debilitated like state where they essentially, without this graft, would have lost their limb. But with this graft, have gone back to being completely 100% back to normal the way they were before the initial injury or tumor.
That's amazing. I'm absolutely blown away. So guys, I just wanted to go ahead and take a moment and say thank you to this wonderful, wonderful individual that's with us. This is Dr. Clark. She's with Fetch in Clearwater. So if you want to Google Fetch Clearwater, she uses, and just to hear that, because, at the end of the day, if you have a situation, she has access to this, which I didn't really know that much about, this special graft technology. So if you want to look her up, if your dog has a problem, check her out. As you guys know, Attorney Walter Hnot, the most viewed, subscribed to, clicked on Disability Attorney in America. I will catch you all a little bit later. Please have a wonderful, wonderful day. If you have additional questions about disabled dogs, disabled cats, or you fear that your dog might be becoming disabled, she's the one to call. But if you are disabled yourself, if you have questions, I'm the one to call. I'll catch you a little bit later. Attorney Walter Hnot. Please remember to like and subscribe. Head over to Google, type in Disability Resolution Law Firm or Disability Resolution Florida. Throw some stars up there if you like. Basically the videos that we produce for you so you can learn about things. Also, I go live on Mondays and Thursdays. And also very important, there's a mini contract below in the bio area. If you go ahead and fill that out, send it the payment, we'll go ahead and do a 1-hour private consultation about the details or claim situation that you have. Attorney Walter Hnot. I will catch you a little bit later. Thank you so much, and we'll have a wonderful day. All right, we'll go from there. Thanks so much. Bye-bye.